السلام عليكم ورحمة الله وبركاته. معاكم ملاك الهدلق. اليوم إن شاء الله راح أتكلم عن oral medicine from a resident's perspective. A little bit of background about myself. تخرجت and I achieved my BDS من كلية طب الأسنان جامعة الملك سعود. بعدها كملت سنة الامتياز، وبعدها تعينت معيدة في Department of Oral Medicine and Diagnostic Sciences في نفس الكلية في جامعة الملك سعود. وبعدها قدمت على البرامج الخارجية. والآن I'm a DMSc candidate at Harvard School of Dental Medicine, and I'm a second-year oral medicine resident at Brigham and Women's Hospital and Dana-Farber Cancer Institute, which are two of the hospitals affiliated with Harvard University. اليوم راح أتكلم عن oral medicine بشكل عام. What is oral medicine? What is the scope of practice? I'll touch a little bit on the residency programs and just some tips on how to apply. We'll learn about the difference of oral medicine versus oral pathology. And في النهاية, I would like to just go over a couple of cases that I've seen in this past year, just to kind of give people an idea of what to expect, what we see in training, what we're supposed to diagnose and manage, and so on. So I hope everybody enjoys it. Before I start, I'd just like to clarify one misconception or myth that commonly is heard when you're a dental student. أتذكر إنه as a dental student, when you are interested in kind of that direction, oral medicine, oral path, and so on, إنه كثير نسمع إنه حرام إنك أنت تدرس 5 سنوات 6 سنوات general dentistry and then you kind of shift towards a different direction. I do not agree with that. وبالعكس الأشياء اللي إحنا نتعلمها في ال5 سنوات هذه والgeneral dentistry is very useful حتى if you decide to go into oral medicine and you actually use your skills a lot, because a part of oral medicine is dental treatment for medically complex patients. And also you have to learn about and know dental disease in order to rule it out and think about other categories of disease as an oral medicine specialist. So before I start, I just want to say that 2020 has been a tough year. Lakin one of the good aspects or one of the good things to come out of it is that oral medicine is now an ADA recognized specialty, which it was not. That was always an obstacle for people to continue, their education. Lakin that obstacle is not there anymore, and now it is a recognized specialty. So what is oral medicine? If we go on the AAOM website, the American Academy of Oral Medicine, they define it as the discipline of dentistry concerned with the oral health care of medically complex patients, including the diagnosis and management of medical conditions that affect the oral and maxillofacial region. And if we go on the European Association of Oral Medicine website, they define it as oral health care of patients suffering from chronic, recurrent, and medically related disorders of the mouth with their diagnosis and non-surgical management. If we were to kind of put those two definitions together and summarize, we would say that oral medicine is treating medical conditions that affect the oral maxillofacial region, as well as providing oral health care for medically complex patients. So I would say those are the main two arms involved in the specialty. بالنسبة للي حاب يكمل residency في oral medicine, في خيارات locally في السعودية and also في خيارات abroad. So في السعودية في طبعا السعودي بورد اللي هو Combined Oral Medicine and Oral Pathology Program, وكذلك في اللي هو DSCD Doctor of Science in Dentistry in Oral Medicine في جامعة الملك سعود. And the other option would be to go abroad, and of course there are programs in both the US and Canada. I have here a table showing the 6 CODA accredited programs اللي موجودة في US. طبعا there are other programs, however these 6 are the CODA accredited, and those are the programs that you would want to apply to. طبعا oral medicine was actually established at UPenn in the 1950s, so that's a little fun fact. كل هذه البروجرامز تقبل international students، وكلها يكون التقديم عن طريق اللي هو الأدية pass. طبعا different programs they offer different degrees. So مثلا the top two here, Penn and Harvard, they offer DMSc اللي هو الدكتوراه، MMSc Masters and Certificate اللي هو فقط residency من غير درجة أكاديمية. طبعا بالنسبة إلى Tufts they have the Masters and Certificate. UCSF and Washington, it's mandatory to do the master's degree with your residency. Carolinas فقط عندها a 2-year residency program. طبعا they're all great programs, and my advice about choosing between them would be based on the type of degree that you want, also the duration of the program, كذلك اللي هو requirements. ففي بعض الschools عندها requirements ممكن أنت تكون ما مسويها فما تقدم عليها. An example would be Carolinas. They require a GPR اللي هي سنة General Practice Residency قبل ما أنك تقدر تقدم على a 2-year Oral Medicine Residency. Another thing to keep in mind, I would say, is personal interest. يعني مثلا for me, I was really interested in oral oncology, so I wanted a program that focuses on that and provides an emphasis on that aspect. For Harvard, they have an oral medicine clinic at a cancer institute, and that's what kind of drew me towards that program. So I would say, go to the website of the program, read about, what they kind of train in, and read about the faculty, and see if those objectives match yours. للي حاب إنه يعني يكمل و apply to an oral medicine residency, and they want to kind of prepare for it, I would have 3 pieces of advice. Number 1 is to do a clinical attachment with an oral medicine specialist. So a 6-month attachment, I think, is a great idea. Number 2 is to apply for observership programs in the program that you are aiming for. فبعض من البروجرامز اللي وريتكم قبل شوي عندهم 2-week program where you go and you observe and you shadow. So you get to meet the program director, meet the residents, see the environment, see the patients, and really decide if that's where you want to be for the next 2-3 years. And then the third piece of advice would be to do a maxillofacial surgery rotation during internship, where you kind of get used to the hospital settings and so on. I also would like to point out, going into oral medicine residency, there are some things that you're going to do not related that much to oral medicine. So for example, you're going to have to deal with dental emergencies. So managing trauma and bleeding and doing extractions, incision and drainage, pulpectomies. And that's because sometimes you're going to be the only dental service in the hospital. So if there's anything dental, you'll be called. وكذلك in the program we learn a lot about oral pathology, oral maxillofacial radiology, and also general medicine. So next I'm going to talk about what is an oral medicine doctor. Who is the oral medicinist? In simple terms, they are a physician of the mouth. So they diagnose and treat conditions affecting the orofacial region. And I would say that the scope of oral medicine can be divided into 5 categories. So number 1 would be oral mucosal disease, سواء كانت pigmented lesions ولا white lesions ولا immune-mediated lesions like lichen planus and pemphigus and so on. Second category would be salivary gland disease, mucosal, sialothiasis, sialodinitis, xerostomia, and Sjogren, and so much more. Number 3 would be orofacial pain and neurosensory disorders, so dealing with myofascial pain and temporomandibular disorders, and also neuralgias and burning mouth syndrome and so on. The 4th category would be oral manifestations of systemic disease. سواء هذه systemic disease كانت immune mediated like SLE, lupus, systemic sclerosis, or granulomatous disease like Wegener granulomatosis and sarcoidosis, or inflammatory bowel disease like Crohn's disease, or even malignancies such as lymphoma and leukemia and their manifestation in the oral cavity. The fifth category, I would say, is oral complications of or related to medical or cancer therapies. So cancer therapy, so on cancer radiation therapy, or chemotherapy, or cellular therapy like stem cell transplant, or even immunotherapy, they have or they can lead to oral complications, and an oral medicinist would be the one to manage and deal in this situation. Next would be a question that I get a lot, which is, what is the difference between oral medicine and oral pathology? And I like to think of it and picture it as a Venn diagram. So we have the two circles, oral medicine and oral path, and they intersect in the middle and they overlap, and there are some things that both specialties do and contribute to. So in general, I would say that oral pathology is a lab-based specialty and oral medicine is a clinic-based specialty. So we can think of oral medicine as the clinical arm of oral pathology, and oral pathology would be a subdivision of general pathology. Typically, the way they work is an oral medicinist would see the patient, take the history, examine, obtain a biopsy if warranted, and then send it out to the pathologist. And the pathologist would then an oral pathologist would examine the specimen histopathologically and give a diagnosis, and sometimes also advise for treatment, and write a report and then send it back to the oral medicinist. And then the oral medicinist can talk to the patient about the definitive diagnosis or working diagnosis and propose a treatment plan and management approach. I would say that is the typical picture or the typical dynamic. Of course, I know that oral pathologists can see patients in the clinic and can obtain biopsies. However, there are some things in oral medicine that an oral pathologist would not be able to do, and a part of that is dental treatment of medically complex patients. Also seeing and treating inpatient is another aspect. So they work together. There are some things that one does which the other does not, but they are two different specialties. So what are some of the procedures that are performed by an oral medicinist? They include biopsies, ordering and interpreting tests, so ordering some imaging studies like intraoral radiographs or CTs or MRIs, and also ordering blood tests. An example of that would be CBC, vitamin B12 levels, iron panels, and also some serological testing, for example, for Sjogren's syndrome, where we order the ANA and the SSA and the SSB and rheumatoid factor and the ESR, and so on. Also, an oral medicinist provides medical management, so treating with topical or systemic medications. Another thing would be specialized injections. So an example of that would be intralesional steroid injections for some inflammatory mucosal disease. Another type of injection would be trigger point injections in case of orofacial pain. And other procedures that an oral medicinist can do include just providing dental treatment for medically complex patients, or advising dentists about the treatment of patients with medically or with complex medical conditions. So an example would be to advise dentists about patients with certain cardiac conditions that might need antibiotic prophylaxis against infective endocarditis. So the next thing I wanted to talk about is the practice settings. So let's say you go into oral medicine and now you're trained and you want to see where can you practice. So obviously you can practice in a dental school, and I've seen this in the US, but I've not seen it for Saudi. I'm not sure. You can also practice in a medical school. So you would teach medical students and medical residents about conditions that affect the orofacial region. Another setting would be in a hospital or a healthcare facility where you can have an outpatient clinic, as well as taking care of inpatients and working closely with cardiac medicine and also oncology and stem cell and solid organ transplant services. Another practice setting would be research, so conducting research, writing papers, contributing to literature and textbooks. And last but not least, I wanted to touch on private practice. So there is a huge misconception that there is no space for oral medicinists in private practice. And I think that is a myth. Because if you think about it logically, the conditions that we see and we diagnose and manage are not uncommon. Think about lichen planus affects 2% of adult population. Think about TMD. Think about RAS or recurrent aphthous stomatitis, which affects 20% of the population. And so it's not that these patients don't exist. It's that they might be seeing other specialists like surgeons and OMFS and perio and also they might be seeing people in the medical field like dermatologists. So it is possible to be an oral medicinist and work in private practice, and I know people here who even have solo practices. And كذلك في السعودية الآن في أطباء oral medicine that they are practicing in private practice في الرياض وفي جدة وفي أماكن ثانية كمان. So yes, there is a space for us in private practice. So that is what I have to share with you today, and I hope that it provided a glimpse into what we see and what we do, and hopefully you enjoyed it as much as I did. I would like to thank About Dent for providing me a platform where I can share this information with people who are interested. And if you have any questions, I'm happy to do my best to answer them on my Twitter account, which is my name, Malak Al-Hadlag. So you can send me your questions and I'll try to respond to them, inshallah. So just as a last take-home message, if there is anything that this year has taught us, it is that life is short, so we should all do what we enjoy. And as people that are thinking about continuing into this field, if you put your heart into it and you work hard and you're passionate about it, then it will definitely open its doors to you. And good luck to everyone.